I am Norma Cavazos, the school board president. It is, I said 6:15, still 6:15, and I'm going to take roll call of the attendance of my colleagues. Ms. Carrillo?
Present.
Thank you, ma'am. Ms. Limon?
Here.
Mr. Luna?
Here.
Mr. Mancha?
Present.
Mr. Moreno?
Present, ma'am.
Thank you. Ms. Ortiz is unable to join us this evening, and she sends her apologies. And myself, I am here, so we do. Oh, I'm sorry. She just sent a message that she is on the way, so I will clock her in when she arrives. We do have a quorum. Mr. Soto, would you let us know who's here from cabin and staff, please?
Yes, Madam Chair, Board of Trustees, Harndale family. Tonight, we have our Assistant Superintendent for Business and Finance, Mr. Richard Hernandez.
Here.
We have our Executive Director of Operations, Dr. Hinojosa.
Present.
We have our Assistant Superintendent of Curriculum and Instruction, Ms. Casey.
Here.
We have our Executive Director of Human Resources, Dr. Salinas.
Here.
And we have our Public Information Officer, Mariana Bravo.
Here.
I remembered her last name.
I was like, whoa, Mr. Soto. Thank you, Mr. Soto. We also have Dr. Judy Castleberry with us. Hi, Dr. Castleberry.
Hello, thank you.
Moving on to public comment. There is one community member that signed up for public comment, Mr. Andrew Grove. Mr. Grove?
There we go.
Hi.
Good evening.
Give me 1 second. I'd just like to give everybody a friendly reminder. You have a 3-minute maximum to speak. The topics addressed shall be limited to those specifically included on the board's agenda and or district related. There is a timer of the 3 minutes on the screen for your easy guidance. So let us know when you're ready, Mr. Grove.
I'm ready.
Perfect.
Whoops. There we go. That's okay. Good evening, members of the board and Mr. Superintendent and staff. My name is Andrew Grove. I'm the Executive Vice President of Sales and Account Management for SWBC's Employee Benefits Consulting Group. And basically just here tonight, we are here in reference to item number 3D. We see there's a reference to the Employee Benefits Program. We've been your consultant and agent of record. I believe we're going on almost 6 years now, about 5 years. And so we wanted to come down and be a resource, obviously, if there's any questions about anything that has happened. And just really wanted to have the opportunity to extend the relationship if that's possible. We think we've done some good work with the district. We've helped establish a solid wellness program. When we first initially were engaged by the district several years ago, things were a little bit out of whack on the health plan. We were asked to kind of help on that. We put in the wellness program, kind of help some of the performance there. I know there's a lot of more work to be done on the health insurance side. On the non-medical side, the dental, vision, those additional benefits, we provide the full administration for that. And I'm pretty proud to announce that we've had no rate increase on any of the products outside of the medical program for 5 years going now. And we've brought in a lot of technology, a lot of wellness programs, and done a lot of things. And so we've enjoyed the relationship, want to express our gratitude for the relationship, and we'd love to have the opportunity to extend it. And then obviously we're here. If there's any questions when the agenda item comes up, we'd certainly like to be a resource for the board. Thank you.
Thank you, Mr. Grove. Thank you very much. Mr. Grove was the only community member that signed up for public comment. Moving on to agenda item 3, individual items.
Mr. Hernandez.
Sure. Good evening, Madam Chair, members of the board, superintendent, and community. This next item is our next step in regarding our bond program. As we know, this past May that our voters voted for $125 million bond package under 3 referendums. And I'll refer you to your board book on page 3, where there's a transmittal, and I'll go over that to cover the highlights, and that'll get us to this step that we're here to do this evening. So under that $125 million bond package, we had $93.5 million in general facilities, which we would call new monies, and $22 million to refund our maintenance tax notes of proceeds that we're currently using for current repairs and improvements of our facilities. And then the last referendum was a 9.5 million for our stadium. So this evening, staff is proposing to issue bond orders for the unlimited tax school building bonds, Series 2022A, and the unlimited tax refunding bonds, Series 2022B. And that one is the next agenda item. And the reason they're separated is because on the school building bonds, those are proceeds, new proceeds, in order to do our new construction under the general facilities, and also to continue our construction on the stadium. The refunding bonds, again, are those referring to our maintenance tax notes. So as we looked at when we have to do our bond issuance, there's several factors that that are taken into consideration to determine how much funding we're going to get in order to support the bond issuance. So property value is one. The existing debt allotment, which we calculated would be about 49% of our principal and payment interest. And of course, what another agenda item that we have this evening is regarding our property tax rate. And one very important item, and one that's very familiar to all of us, is the interest rates. So as we know, they've been rising, but again, we're monitoring that. So depending on the interest rate and where it's at, that's also going to have a big impact on how much we can issue. So as we look at page 3, the initial capacity that we first proposed to the community that we presented was going to be $50 million this year. And so we're moving very quickly in order to get ahead of rising interest rates and also get ahead of others that are going to be doing bond issues. So our first estimate was 50 million for this year. And then our projections are for 33 million and then 42 million in 2025 and 2030. So when we look at our current situation in regarding to our property values, the EDA, the tax rate that we're looking, but again, more importantly, the interest rate, the way it stands right now is that we're estimating a bond capacity, what we call bond capacity, of 40 million. So when we estimate that, then if you look on page 4, we present how we would plan on doing our issuance. So of that 40 million that's available in bond capacity, then 3 million would be for the refunding bonds. And the reason for that is because that allows us to make a small portion of money set aside in order to pay those maintenance tax notes. And what that does for us is that it allows us to extend our principal payment from 2025 all the way to 2027. And so if that's accomplished, then we're able to change the amount that we had to pay over those years from 7.4 million down to 2.1. And the reason that that's important is because we right away tap into the state's funding support to where they'll be paying 49% of that of principal and interest instead of us paying dollar for dollar. It also provides us the capacity so that when we're ready to do our bonds in 2025, again, if by chance our ADA is not where we want it to be to get us to the bonding capacity, it gives us more time, because from now to 2027, if we're able to do this issuance and pass this bond order, then all we're going to be doing is paying interest. And so that's where the 2.1 million comes in instead of paying the principal and interest. So after that's basically carved out, then we have the remaining monies to do our general facilities, our stadium. So one of the things that we can say is that the remaining monies that we would get from the bond issuance of this month, 9.5 million would go to our stadium, because our plan is to complete the stadium by about August of 2023. So right away, we're going to need those proceeds in order to pay for that, and again, avoid having to go to the fund balance on a reimbursement. And then the remaining amount would then be for the other general facilities that we've listed, and one in particular is our CTE building. And so this evening, we have our financial advisor, Richard Acosta, here, and Clay Binford here as well, to help us walk through the approval of these bond orders. So In this particular agenda item, this is approving the bond order for the unlimited tax school building bond series 2022A. And then the next agenda item will be for the refunding bonds series 2022B. But I'll be happy to answer any questions, or we will, if the board has any.
Madam Chair,
Yes, Mr. Moreno.
if I may, please. So whether it's Clay or Richard or Mr. Hernandez, just reading it. So 22, let's see, the first bullet, which is 2022B, the 3 million. I kind of understand the whole 40 million, going and refinancing with the 3 billion. I mean, the 3 billion, excuse me. Is that the only amount that is going to be 49% where we're not paying dollar for dollar? Or I don't know. There's a
Sure.
lot of information you shared with us right there.
Sure, sure.
And being a person that I have like 5 hours of sleep today, it's kind of a little difficult. So, and I know this wasn't given to us beforehand. So,
Sure.
Good evening, Clay Benford, representing the district as bond counsel. It's an excellent question. I think I would like to first say that we have to determine how much debt we can amortize, we can pay off based on our 50-cent capacity. That's the legal maximum that we can issue in additional debt. And that has to cover the combination of principal plus interest of the new debt over the amortization period. As interest rates rise, more of that formula has to go towards interest, which means we can have less in principal. We were hoping that initially it was going to be 50 million. As interest rates have risen, we think that conservatively your capacity is more 40 million. And so that means you're going to have less new money proceeds. It's important to note that that additional $10 million in capacity does not disappear. It's just that the property values at 50 cents can only support that amount of money right now. So as we have to wait till we grow or interest rates go down and before we access the additional capacity. So it doesn't disappear. It's still there. It's still legally authorized. It just might take us a little bit longer to get to it. The $22 million, it amortizes annually in pieces of principal beginning in 2025. You have to pay interest currently, and you have to pay a dollar for dollar amount out of your general fund for principal and interest that's coming due. Instead of taking a significant portion of that $40 million of current capacity, we're instead recommending to take a small piece of it to give you budgetary relief in years 25 through 27, because we can issue those refunding bonds over time. So if we take $3 million, we can give you and refund it long, we're still paying that back, but it's coming out of the $40 million. That $40 million becomes eligible for state assistance, which is the 49% that we get back from the state. And we still have capacity to do new money projects, which are the stadium and the other authorizations under Proposition A. And then we'll come back and revisit in 3 years in 2025 and look at where we are at that point in time. We would then only be paying interest. The principal will have moved out of the general fund onto your interest and sinking fund portion, so that we have, again, lesser pressure. We're still paying our debt. We're still paying our principal. We're being respectful of everything that we're legally required to do, plus what we've told our voters. And since we can issue bonds in multiple series, we can then look and see, we'll have $19 million left outstanding. Can we refund 28 through 31? Can we refund all of it? It'll just depend on what the market looks like at that point in time. So it buys us a little bit of time. It gives us budgetary relief and allows us to continue projects that were approved by the voters and fit within the short-term capital plan. Does that answer your question, sir?
all right. So I guess just to clear it up, so in this case, we're looking at a $50 million allotment, more or less,
40.
right? And then we're saying, but follow me, please.
Okay, sure.
So 50 million. And then we're saying, well, because of the budgetary relief that we want to, be able to have, and what our actual tax rate or our taxes can actually be absorbed towards, or as you put it, property value can only absorb 40 million.
Mhm.
So we're going to go 40 million right now because of that. So the 10 million is still there.
Mhm.
That is still accessible at some point when we reevaluate. And then when we go back, we're saying we're going to be, so in essence, I guess what I'm trying to figure out is it's that 40 million or 37 million or 3 million is still going to be, where we're going to have the 49 cents per dollar, right?
That's correct.
Okay, that's what
That's
I was just
correct.
wanting to
Yes.
make sure, because when I read it, I see it, I'm looking at, is it only 3 million?
No.
And then we're staggering it, and it makes sense when we're amortizing it, as Mr. Hernandez mentioned. But I just wanted to make sure that Yeah, go ahead, Richard.
Hi, good afternoon, good evening. This is Richard Acosta with RBC. I'm your financial advisor. The 3 million that we issued out, or the 22 million that we issued out to get the project started prior to the to having the bond election, it was actually to kind of jumpstart and not wait and to get projects going. That is on the maintenance and operation side. That does not receive state funding. So by moving it over, that 3 million will start to receive state
Okay.
funding. The other balance that we're going to issue out in the INS, that is going to receive state funding. So altogether, all your bond projects that you just got authorized at 3 different propositions are all going to receive state funding. And so, but we're slowly moving it over to give you that budgetary relief, because right now you're paying out of your general fund for that, and you're going to be paying principal and interest if we don't do anything. But we want to go ahead and use some of the capacity we have right now to address that, to be, respectful, prudent, and not kick the can down the road, just kind of move it over a little bit at a time to give you the flexibility, that optionality that you need in case rates continue to rise. Now, rates have gone up over 200 basis points since you started this process. As soon as we called the election, it just started shooting up. Now, the last 2 weeks, we have seen it come down close to about 70, 80 basis points. So that capacity is returning. And we've actually gone and written in the bond proposition to believe up to $60 million in the event that the market continues to come down between now and the time of pricing, which is expected in late June. We have to get all the offering documents ready. We have to work with rating agencies, and so forth. So we want to have flexibility in the event the market comes back in our favor. We didn't just come and just ask for 40 million. We asked for the 60. So you would have the option, you'd have the ability to do new projects now and still pay off a little bit of that debt.
So I guess going back with that, Mr. Acosta, and you kind of hit kind of a bullet for me in terms of when we're looking at the savings, because we're looking at, we were expressing to our voters, we're going to get potentially, some money back that we're going to be able to utilize for some other projects. How does that align with that? Like, how can we convey that and be correct? Because are we just refinancing and paying off our debt? Or are we able to, like you said, really use it for other projects or other things related to M&O and I?
Initially, again, before we actually issued out these maintenance tax notes, we actually had a reimbursement resolution. So you got started on your projects. And then when we did issue maintenance tax notes, we reimbursed the district for all your expenditures. Now, what we're going to do is with this new, this last proposition for 22 million to refund those maintenance tax notes, we're simply transferring it over. There is no actual savings. Because there's not going to be additional proceeds that we can create. Now, if we issue it out and get lower interest rate, you potentially could save on the overall project cost just because or the interest cost associated with those projects. But potentially right now, there is no actual dollar savings like you're going to get returned back into your general fund.
And that's perfect just because it clears it up for us, because I know the misconception is always, well, if you're saving, you're getting these savings, how can we put it back into the general fund, and how can it be pulled for something else? Because that's always going to be misconstrued. And I just want to be clear where all of us understand.
Sure. And I guess actually I might have misspoke. Just the fact that there could be savings would be that right now, if you just left it on the maintenance and operation side, you'd be paying 100%. If you move it over, you're going to get the 49%. And so you will be saving. The state would be picking up the other portion of that. So there is that type of savings in terms of interest expense and principal. It goes to all the total amortization. So you're going to be paying principal and interest, and the state's going to pick up 49% on both of them.
Yeah, so it's kind of like, it's kind of a layman's term type of analogy, but we're looking at it in terms of perhaps if we have these high credit card bills and we're saying, let's go ahead and consolidate it to a credit union where we can absorb, one payment and it pays off all, and maybe a faster type of approach. That's kind of the idea more or less that we're
Correct.
doing with the shifting of one section to the other, right?
Yeah. And also like in a sense that the government would come in on the second credit card and start picking up a portion of it.
Any other questions or comments from my colleagues? Good questions, Mr. Moreno, because it answered a lot of the ones I had. Oh, I'm so sorry. Ms. Ortiz has joined us. I clocked her in at 6:29. So, hello, Ms. Ortiz. So any other questions or comments on this particular item? I know it's a lot to wrap ourselves around. I don't know, do we? No, so we can go ahead and move.
Clay,
I'm sorry.
do they have to read the full
They
agenda?
don't. You can say
What-
move to approve item 3A as presented and move to approve 3B as presented.
Yes, sir. It would be the same presentation.
I just have one quick question, just for clarification, before you go there, Mr. Moreno. So not only us transferring this money, not only is it allowing us to not pay dollar for dollar, but it also allows us to start those projects that the bond that were allocated for, the bond was allocated for specifically. We can start them sooner rather than later.
Yes.
Okay, okay. I just wanted to make sure I had that clarity. Okay, Mr. Moreno.
All right. Well, anyone have any questions or? Okay. And just to be clear, one more thing, Madam Chair, Mr. Soto, that's where we already started the phase one, right? That's the first part?
Phase one of the stadium was not part of the bond proceeds. Phase two is, the 9.5 is.
Okay,
Yes, sir.
perfect.
Thank you, sir.
Just to clear that up, thank you. All right, so I'm gonna go ahead and make the motion to approve items 3A and 3B as presented.
We do separate.
Oh, you want me to do it separate after all? Okay, so here the reading is, I move to approve the order of authorizing the issuance of district unlimited tax school building bonds, series 2022A, levying a continuing direct annual ad valorem tax for the payment of the bonds and delegating to certain district officials, staff, the authority to complete matters in connection therewith.
Second.
Thank you, Mr. Moreno. Thank you, Ms. Carrillo. Any further discussion or can I move on to the vote? Okay, I will be moving on to the vote. Ms. Carrillo, yay or nay?
Yay.
Ms. Limon, yay or nay?
Yay.
Mr. Mancha, yay or nay?
Yay.
Mr. Moreno, yay or nay?
Yeah, ma'am.
Mr. Luna, yay or nay?
Yay.
Ms. Ortiz, yay or nay?
Yes.
Thank you. And myself, yay. So individual item 3A passes. Mr. Moreno?
I'll go forward again to move to approve the order of authorizing the issuance of the district unlimited tax refunding bond series 2022B, levying a continuing direct annual ad valorem tax for the payment of the bonds and delegating to certain district officials and staff the authority to complete matters in connection therewith.
I second.
Thank you, Mr. Moreno. Thank you, Ms. Carrillo. Mr. Mancha, yay or nay on agenda item 3B?
Yay.
Thank you, sir. Mr. Moreno, yay or nay?
Yay, ma'am.
Mr. Luna, yay or nay?
Yay.
Ms. Carrillo, yay or nay?
Yay.
Ms. Ortiz, yay or nay?
Yay.
Ms. Limon, yay or nay?
Yay.
And myself, yay. Agenda item 3B also passes. Mr. Hernandez, you're doing 3C?
Yes, ma'am.
Okay.
So as part of our budget process, we have to have the board approve approve a tax rate in order for us to officially put it in our notice. That is what we're presenting this evening on item 3C, to take action to approve the proposed 2022 tax rate, which will be in the notice required under current law, section 44.004. And so if you look on your board book on page 110, basically the transmittal is there, kind of giving you a narrative of what's being done. So on July 25th, 2022, we should be getting our certified values, which then takes us to the next step in August to officially adopt a tax rate. So what we have to do at this point, without having it certified, is to go ahead and approve a tax rate only so that it can be officially put in our notice. So when we go through the computations as guided by TEA, the maintenance and operations tax component of the tax rate is at 0.9701, which was the same for last year. The INS, the interest and sinking component, is now going to increase to 50 cents, as we all know, because of our bond issue and our wanting to maximize the amount of funding that we can get when we do our bond issuance. And then that would be at 0.5000. So again, these are the proposed and tax rates. Again, depending what our certified values come in at on July 25th and what type of bond issuance we do this month, that will drive mainly the INS side of it. The maintenance and operation tax rate at 0.97 is pretty much what TEA guides and computes for the district, as well as, we also go through our computations. So in total, when you add the both of them up, the tax rate then is proposed to be at 1.4701 compared to 1.4007, an increase of 0.0694.
Thank you, Mr. Hernandez. Any questions or comments?
Madam Chair. if I
Yes,
may.
Mr. Moreno.
So Mr. Hernandez, if we make the motion, do we have to specifically or explicitly say that number or do we have to wait till later?
No, so that would be till later. That's correct.
You could
That's
just
in
read it
August,
as- okay.
but all we need to do is just read it as it's worded on the agenda item.
I have a question.
Yes,
That's
Mr.
right.
Ortiz.
Mr. Hernandez, is there any chance that it'll decrease?
It's possible on the maintenance, on the interest and sinking. Again, depending what our certified values come in at in July 25th, and then how much we do in a bond issuance in June. We're doing our bond issuance now, again, to take advantage of the, try to get ahead of the interest rates. But again, we'll determine that when we get our values at the end of July, and then propose it for adoption in August.
Okay, I have a couple more questions. Have we looked at how many of our properties, property owners have filed for reconsideration of their bear appraisal, bear appraisal? And the reason I ask that is because, the increase was the highest it's ever been. But also by the same token, Bear Appraisal District said that they have had a record number of protests. And so, but it's very, very common on the north side for them to protest, but it's not that common on the south side. So I'm wondering do we have any kind of clue whether how many people have protested in the Harlandale Independent School District? Is that something that we're even considering? Only because I know personally that tax rate, that appraisal that I got on my house was ridiculously high. I'm doing the protest and I said, so I told my husband, I said, even if they go half, I still, it's more than what my other house is worth. And I was just saying, and they're going to think that, okay, well, if you settle for half of what they appraised it at, you think you're getting a good deal, but it's still more than what my other house is worth.
Sure. Yes, ma'am. In fact, I'm also protesting myself. But yes, they send us a report each month and letting us know how many cases have been filed with them, what's the value of that. And so that's why at this point in time, this is just basically an approved proposed tax rate, because it's not until at the end of July when all of those have been settled, and then they come back and say, okay, this is your certified value. And then that's what we're going to be basing our tax rate on the INS side. But we certainly can provide that to the board, how many cases and the value and what property value that represents.
And we'll get that report when all the protests are done, right? We'll find out how much it is.
They
do we
give
get
us
that?
they give us a status. I'll check with them when their next report will come out, and then I'll certainly provide that to the board.
But when we get final,
When we get final, yes, then
that'll be the end of July?
yes, ma'am, because I think all protests need to be settled by June 30th, if I'm not mistaken.
Thank you.
Any other comments or questions? Mr. Luna?
Madam Chair, on that note, when I tested last time, basically I just stayed the same. My property stayed the value the same. So I don't think most properties are gonna go below what their value. So in the end, we're gonna still get that same amount of tax revenue from that property. I don't see it going down too much. On the other things, I'm trying to understand is that because of the tax, because the property values increase, then we're gonna get higher income, right? Because they're taxing it on the same, even if it's the same tax rate, it's gonna be, the property is gonna be worth more, so to speak. and they're gonna get more, people have to pay more taxes, correct? So we're gonna increase there.
Yes, sir. And so what happens with our particular situation as a low wealth property district is that, yes, as our tax revenues increase because the values go up, then the state amount then goes lower because the effort of the equity is trying to balance between all school districts, the amount of revenues you get both on property value and state funding.
So where does that leave the balance of the income? Up the same or
It
higher or lower?
It would be the same, but then again, one of the other things that the state has in place is what they call tax compression. So they are trying to limit the amount of taxes on the property owners.
Any other questions or comments? Okay, thank you, Mr. Hernandez. So, you ready for a motion? Or is there more discussion?
I'll go ahead, ma'am.
Thank you, Mr. Moreno.
I move to take appropriate action regarding the approval of proposed 2022 tax rate, which will be published in a notice as required by current law under section 44.004 of the Texas Education Code.
I'll second.
Thank you, Mr. Moreno. Thank you, Ms. Carrillo. I will take the vote. Mr. Mancha, yay or nay?
Yay.
Mr. Luna, yay or nay?
Yay.
Ms. Ortiz, yay or nay?
Yay.
Ms. Carrillo, yay or nay?
Yay.
Ms. Limon, yay or nay?
Yay.
Mr. Moreno, yay or nay?
Yay, ma'am.
And myself, yay. So agenda item 3C passes. Moving on to 3D, Mr. Hernandez. Oh, no, Dr. Salinas.
Yes, it's a team effort. I'll be presenting for cabinet. If you recall last year, first of all, thank you, Madam President and board members. If you recall last year, I think we came to the board 2 or 3 times, maybe 4 times before we moved forward with our insurance agent of record and insurance for this year. And we had told the board last year, we're going to do things differently next year. As Mr. Grove stated, we have had an excellent relationship with SWBC, but we also know that best practices every five years or so, we should look at a different agent of record. For no other reason except that it's just best practice, just like with all the other vendors as well. And so we looked at beginning of this year, we started talking about insurance cabinet. Mr. Soto actually went to a superintendent meeting here in Region 20 and they were talking about insurance and certain superintendents were bragging about their insurance and talking about that they belong to a co-op. So he tasked cabinet to start researching and let's see what are some other options? Can we be creative? And so one of the first things we did is we actually met with, let me see, with the Employee Advisory Committee. We have a member from every department and every school. We had a meeting and if somebody could not attend, we did ask that they find another person, another representative from the campus. This is a list of the representatives from elementary school, middle school, and high school. There are actually 30 members. That day that we had a meeting, we shared what was going on, what they liked, what they didn't like. I'm going to share with you in just a second, their responses. And then we also gave them a survey so that they could also just email us their responses and also ask them, would you like for us to explore a self-funded option? 92% of them said yes. So then we went ahead and here's feedback from them. What they liked about our current plan. They liked that the mental and behavioral health was covered. They liked that there was a large network. They liked the wellness program. They liked telemed. They also liked, and this was only for people who have employee only choice, they liked that for them, the premium was less than the year before. Concerns with our current plan, and our current plan is United Healthcare. Cost of preventative care, the copays, the prescription costs and deductibles. The dental had hidden costs. Limited prescription list and limited pharmacies. In particular, they mentioned that now we can't go to CVS. Pediatrician and pregnancy care was too expensive. Poor communication, they stated with United Healthcare staff, it was difficult to work with them. Many of the doctors were not taking new patients. The emergency room cost was high and some Some people had procedures that were approved with Blue Cross Blue Shield, but then shared that, but now that they were United Healthcare, they weren't approved. So they were having some struggles with that. We also presented just some data, and you can find this on the internet. This is what we know. So we know that since 1999, premiums for single and family coverage have increased. And as you look at this graph, we could predict what 2022 would probably look like, and 2023 and 2024. So it doesn't look like it would get better based on the data. We also know that people are worried about unexpected medical bills. And we talked about this with the committee. If you received a $500 medical bill tonight, something happened, would you be able to pay it? A lot of people said no. They're concerned about unexpected medical bills. Again, this is from the internet. You can find this on the internet. 65% were concerned with unexpected medical bills. Health insurance, prescription costs, anything in orange there has to deal with medical insurance concerns. And the last thing was about prescription drugs, because that also came up. So they surveyed and who found it difficult to afford the cost of prescription medicine. And you'll see 35% are taking more than 4 or more prescription drugs. 58% to spend more than $100 a month. 30% are between the ages of 50 and 64. If you classified your health, 49% said they were fair or poor health. And then the income of the staff that were, or not the staff, this survey result showed that 35% of them made less than $40,000. So what we learned that currently we have a fully insured plan, which means that the insurance company assumes the financial and legal risk of loss in exchange for a fixed premium paid by the employer. Right now, just for the $350 that the Harlandale contributes, that we contribute, we pay to United Healthcare $521,150. That does not include the employee premiums that we pay on top of what Harlandale provides. Harlandale ISD has been members of the Choice Partners Purchasing Cooperative for about 10 years. Choice Partners, which is part of the cooperative, has 5 insurance providers as part of their co-op. Cabinet met with all 5 providers, different days, different times. We met for about an hour with each one. Some were virtual, some were in person. That was their preference. And we wanted to discuss how could they assist Harlandale in exploring self-funded options. The 5 that we met with were Arthur J. Gallagher, Risk Management Services, and they're just listed as national on the actual co-op website. Brown & Brown Lone Star Insurance Services, they're listed as Texas. Financial Benefit Services, FBS, is Texas. First Financial Administrators, Texas. And U.S. Employee Benefit Services Group are listed as national. As a self-insured plan, we have the following advantages. So if we choose an agent of record tonight and we want to explore self-insured plans, we would have plan design flexibility, which means we can design a plan that's best for Harlandale ISD. Harlandale ISD would have control over reserves and cash flow. We would be able to reduce operating expenses. We would be excused or avoid state mandated benefits and premium tax. Risk management effectiveness through stop loss insurance. We would have transparency with all costs, so there would be no bundling fees. So everything would be itemized. And HISD would not pay premiums, we would pay fixed costs. For example, administrative fees, stop loss premiums, and employee claims directly. And that would happen monthly. So how do we compare? So we did look also, we learned a lot about insurance cabinet, we all did. And we wanted to see, well, how do we compare to the districts in San Antonio? And we learned some interesting things. Size didn't matter, big or small. Who you used, Cigna, Humana, Aetna, we have United Healthcare and so does Northside. Now Northside's very large. And you can look at the different premiums there. You have it in front of you, so in case this is hard to read. One thing we noticed, though, I know one of the schools in particular, and I'm going to mention the district Northeast, they brag about, we want teachers here because we tell them we have the lowest rate for family. And if you'll notice, Harlandale has 1,327 employees that are on employee only. Now, we haven't asked everybody why, but one of the reasons might be the cost. Employee only has the lowest cost, depending on what plan you pick. And when you see 4813 for employee only through 9788, that's because there's different options. There's a low option, there's a high option, and then we have two mid options. So we just wanted to show you the range. And so that's what I've put here in this graph, are ranges for each district. But if you look at our family employee, we only have 51 participants in the district. And look at the monthly premiums. Minimum $940 a month, maximum $1,100. The in-network deductibles, I also placed there for you to see the comparisons. Some go up to 10,000, some go to 12,000. And then you'll see at the bottom, just anything special or what they used. And we noticed that East Central, which is another superintendent I know that spoke with at the meeting that Mr. Soto was at, and they talked about being part of a co-op. They use Cigna and they have a clinic that's free for well visits and primary care for their employees. Northeast was self-funded. Edgewood also has a clinic that's free for wellness and primary care. And Southside has a free wellness and primary care center for their employees. So if we look at just the kind of the special groups, I'm going to say the ones that are self-funded and or use a co-op right now, that in particular we were looking at was East Central and Northeast ISD. And then we also noticed Hayes Consolidated. So one of the groups, the one that we're asking for approval tonight, actually created a plan for Hayes Consolidated ISD. They call it the Advantage Plan. The employee only cost $0. Employee and children was $305, the premium. Employee spouse was $700. Employee family was $900. The in-network deductibles was $750 and the family was $1,500. They also have this plan that's called KPP free for Hayes. Now it's individualized for Hayes. They're closer to Austin. With the KPP free plan, what we found out, we were surprised and kind of excited about, was that employees could go and they would have free lab work. They could have free surgeries. Now, not all surgeries, but a lot of surgeries. We have people here who aren't, I mean, I know we have in our departments, I know Miss Casey and I have talked, who are not having surgery that they need because they can't afford it. X-rays also are included and MRIs. So that was very enticing to us. Doesn't mean we would have the exact same plan because we're not like Hayes Consolidated, but we did like that they were able to customize it for the district.
I have a question.
Yes.
When we're looking at employee only, that's the amount that the employees pay after the school district pays the 350.
Yes, ma'am.
And so when they have zero, it's because they've covered the entire cost of it.
Correct. Correct.
Madam Chair, I didn't want to interrupt, but when you see the employees only and in parentheses, it has 1,327.
That's how,
Go ahead.
that's how many of our employees have that coverage.
Okay, then straight across, would that be also with East Central?
No, I don't know the
Just
East Central
okay.
numbers. I don't have any of that data.
Those are
We would,
just Harlandale
right,
employees.
that's
Okay.
just for Harlandale. That's for us to know here.
Okay,
Yes.
Great, thank you so much.
Uh-huh.
I appreciate it.
Why can't I move it? Oh, there you go. So here's what we currently do. We have 1,489 staff members who utilize our medical insurance. Harlandale contributes $350 per employee per month. That's $521,150. When you multiply that by 12, it's 6.2 million. Employees, so on top of the 350, employees contribute, again, we went low option, high option, between 82,000 to 270,000 a month for an annual total between 2.1 million and 3.2 million. That's on top of the 6.2 million that we're giving for somebody else to deal with. Prescription rebates, we do not see any prescription rebates. And this money currently is paid to United Healthcare regardless of our claim status. So everybody could go to the doctor, nobody could go to the doctor, 15 people could go to the doctor, it doesn't matter. We're going to pay for sure the 6.2 million and then whatever the premiums are for the employees. As a partially self-funded district, what we learned. Again, this is with the same contribution, so not changing the $350 contribution. If we still stay with 1489 staff members utilizing our medical insurance, of course, we'd like to increase that. Harlandale ISD contributes $350. Again, I'm not going to go through the numbers again, but again, it's $6.2 million a year, $521,000 a month. District and employee contributions would remain with Harlandale ISD. With that 6.2 million, that would stay with Harlandale. Of course, we would have to pay claims and whatever's left over would stay, but we would still be able to keep that versus giving it away every month. Prescription rebates would be given to Harlandale ISD for deposit. We would work with a third-party administrator to review claims each month and review our insurance fund balance. We would also have a stop-loss insurance in place to protect the district against large individual healthcare claims, because we could have one employee that has $300,000 in healthcare claims. Cost for administration services is approximately $15 per person per month. At 1,489 individuals, that would be $22,335 per month instead of the 521,000, or $268,000 per year instead of the 6.2 million. This would change based on the number of employees utilizing the insurance, obviously. Potential challenges, because it's going to be a challenge to change, because different always makes people stressed out. So one of the challenges is time, because the agent of record would need time to work with our current agent of record to get all of our data, to get the data so that they can then start securing quotes. They need to do that pretty quickly. Learning a new way and ensuring our staff are knowledgeable on our benefits, that's going to be huge. So it would be a lot of instruction, a lot of educating of our staff. Our insurance card might look different. Instead of having one of these logos there, they might not have a logo. It might just be an HEB logo. And I just said HEB for Harlandale Employee Benefits. I'm not in any way saying HEB, the grocery store. Or right, Harlandale Employee Benefits, or whatever we choose to name the self-funded program. We can call it whatever we'd like. That was just an example I wanted to use there. Next steps, what would happen? So we would need to secure an agent of record. Again, Cabinet is recommending Brown & Brown Lone Star Insurance Services. Share our current data so that the agent of record can begin to secure pricing and build samples of self-funded plans for HISD. The samples would then have to be shared with the Employee Advisory Committee to determine which plans meet our needs at the best cost to our district and employees. So Brown & Brown's not going to decide. The insurance committee would meet, would look at the plans and make the best selection, that because they talk to all of their staff on site. So they go back to their campus and talk, they go back to their departments and share. And then we would get a determination on which one works best for us. After a plan or plans are selected, we would begin our information sessions. So we would be able to start educating everyone on this is what's happening, this is what's coming, because this won't happen until January of 23. New plan rates would be in effect beginning January of 23. And then we would provide quarterly updates to the board and to the Employee Advisory Committee, because we want to keep securing ongoing feedback. And we want to keep you updated with what's happening to the money. What are we spending it on? How many claims have we had? And I think that's what I have. So if you have questions, I can try to answer them.
Madam Chair,
Yes, Mr. Moreno.
if I may go first.
Go
Thank
ahead,
you.
go ahead. I'm sorry.
So I appreciate Dr. Salinas, you guys bringing this forward. I know that's something that we've inquired and we're hoping for some consideration these last couple of years. And, you know, kudos to you guys for making it done. I know Mr. Soto made it a plan of action. So I know in years past, it's been kind of said it's not a possibility, it's not feasible. And I know the clarification here of like, it's not the amount of people, but more so the utilization and the amount of claims. So thank you again for reiterating that. So in looking at it, it looks like a grandiose plan. I mean, it's kind of preliminary, But is there a way that you can kind of enlighten us and share with us how, when you noted the stop loss insurance in place to protect the district, how would that work? Or can you elaborate on that for us to get a better understanding? And then perhaps the cost?
I might refer to Mr. Hernandez on the stop loss.
So on the stop loss, as we understand that there's two types. One that will put a stop loss on the claims, as Dr. Salinas had said, an individual will be at a stop loss of 200,000. So as his claims, if they're 300,000, then the insurance company picks up that remaining 100,000. Then there's another stop loss that provides a cap as to how much the district would have in expense. And then throughout the year or at the end of the year. So that way, if there's more of an expense than what we're getting in premiums, then that the insurance company is going to pick that up. So that way, it helps us reserve and won't have to have us go into a fund balance to cover for something that was unexpected. That how we understood it.
So does that kind of align and correlate with the administrative aspect of it? That's what we're paying for, is that fee per individual or utilization?
No, so that fee is for Brown and Brown, but that is the premium for those two types of insurance would be included in the total cost of the program. So basically, it's another cost that we're incurring as we incur claim cost as well.
Okay,
So
that
there are
number,
some administrative
that
costs.
hypothetical number isn't there yet. is it?
No, sir.
So we
No,
don't
sir.
know what the cost might be.
Correct, correct.
Okay. So eventually it could be hopefully not catastrophic.
No, and so we would put that out for bid to make sure we get the best price on the premium. And again, they're going to look at our data. They're going to look at the number of claims that we put in, the types of claims that we put in, and then they'll do their projection, then determine what type of premium cost they'll need to charge us in order to provide that coverage.
Okay, so then that's kind of leveraging our resources with that of an agent of record.
So
Or-
I'm sorry.
Yeah, is that what it is? It's collectively?
Sure. Because now we're not just paying United, a health insurance company, then we're keeping those proceeds of what we're paying, what the district pays in its contribution, what the employees also pay. Then those monies would be used for those premiums.
So with that, I guess it might answer one of the questions I had, because I was looking at, well, we have 6.2 million and that looks fantastic in comparison to, the cost of savings of 268,000. We're looking at that numbers, you're just like, that's eye-opening, and you're looking at it and saying, well, if that money is kept within HISD, as Dr. Salinas mentioned, well, how would this be reallocated? And I'm assuming then that would go towards those instances.
Sure. So like we use that number 6.2 million. If that's the amount that we would get in premiums, both the district contribution and the employee's contribution. Then you start subtracting the expenses, which was at 268,000, the premiums that we pay, any claims that we pay. At the end of the year, if we have $1 million or 2 million left over, that stays in the self-funded. It goes forward in order, and then we make an evaluation. Do we want to build up that fund balance, or do we want to use some of that money to provide more benefits in the following year? So
Okay.
we have Brown and Brown or that type of service that would help our employees. Our committee then determine how do they want to utilize that money's left over at the end of the year.
Well, that brings up another question in my mind just now, but would that be, would that earn interest at any point? Would that earn interest?
Oh,
at-
of course. of
Okay,
course,
so
yes.
that's something that
Yes,
potentially can increase the
right.
amount that we can leverage.
Sure.
Okay.
Sure. And with the rates rising, that may actually help us.
Okay, and then I guess another question I had in relation to it is, we have a team, obviously, I don't know, Ms. Majado's back there still, but how would that impact her team, and how would they be used as a facilitator, or what the role would play in going to this type of model?
So Ms. Guajardo is the team. And she does an excellent job, and of course her AA and myself. And so we would continue to work with Brown and Brown, much like we've been working with SWBC as the agent of record.
Okay, well, I mean, it seems like a very ambitious plan, and I'm excited to see where we can go through it. I know the big thing is our families have said for as long as I've been on having the privilege of serving on this board, is they've been insurance poor. And that's been something that it's not just an issue here, it's an issue practically in every ISD. So, that's something I'm glad that we're trying to make some tangible steps to help.
Madam Chair.
Go ahead, Ms. Lebon, yes.
So on page 7, where it has the insurance for the employees that they currently pay, the $521 per month, is that correct? On page 7? Yes,
I'm sorry.
is that correct, that what they pay now?
That's what we pay. We pay
Okay.
$521,150 to
Five-
United Healthcare.
Okay, so that's what you guys pay.
That's what Harlandale pays.
So we know for sure we're not gonna be paying this.
What,
If we go.
we're
self-funded.
still going to be spending the 300, but we're not going to be giving it to United Healthcare. It's going to stay not with Mr. Hernandez, but in the bank, obviously.
That's what-
And then every month, like he said, we're going to reconcile and look at premiums and look at, I don't know what we're talking about. Look at different, how many people have gone to the doctor. We're going to look at all of that. Yes.
But and also per month for a family, we know for sure they're not gonna pay that amount.
Oh, the current premiums?
Yes,
So that's our goal, is to reduce our premiums and to look at that through a self-funded plan. That's our goal.
I mean, that's our goal. because
They
we
have to
don't-
look at the data. They have to then go out for bid and they have to see who's going to give us the best number,
Yeah, because we're not sure.
best rate.
Right?
That's correct.
We want to make sure that we are as low as we can get it for.
That is
I mean-
correct.
I mean, it's every year we have this problem with our insurance and our teachers have to pay so much. And you know, they get a raise and what's for a raise when they have to pay so much on health insurance? And if this helps, I mean, you know, hopefully it helps them. I really, really would love something to happen. If this can happen to our employees, there's a lot of numbers.
I know.
And
I
I
know.
hope this comes out and a positive to our teachers and staff.
I can tell you that we will continue to promote wellness and we will hopefully have a facility or somewhere we can go, just like the other districts, where it's at no cost for your primary and preventative care. That's definitely a goal.
And that little area, the health center that we have over there by Collier, that has nothing to do with our district.
That's for our students right now who can go get free
That's
immunizations,
just
but
students.
once an agent of record is selected, we can certainly share that facility with them. And then they could always reach out. Because that's one thing that they will do, is they talked about, if we have like a local doctor, let's say everyone likes Dr. Mancha and they all go to Dr. Mancha, but Dr. Mancha doesn't take, let's just say, a big United Healthcare, or they would then work with Dr. Mancha to say, we want to pay you directly. Harlandale wants to pay you directly. Would you be able to see our employees and move forward that way? So they would have an agreement with different doctors.
Great, great. Thank you for sharing that. Thank you.
Madam Chair. As Dr. Salinas, good questions, Ms. Limon. As Dr. Salinas shared, there's 2 districts that have that clinic on site. One is Edgewood, or 3, Edgewood, Southside, and East Central. But we don't have that here. It's only for children right as of now.
Would I have maybe Mr. Soto or Miss Chair?
You know what? I think Ms. Ortiz, did you have a question?
Just to
Ms. Ortiz?
clarify
Oh, no.
that part, because
Okay.
like, I don't know how we use it at Southside, to be quite honest. I never know when it's actually open. But it has been suggested here and there. And when I recommend students to go, it's not open. So I don't know how they.
Well, we will
utilize it.
make sure and communicate all of the hours when we get a site.
Because I'm
And
always,
everyone will
I'm always
know.
trying to get my kids into sports and then
Right,
it's always like, they're like, oh, they said they're not open or they're not answering. So sorry, just to, but no,
We will try to avoid that.
Mr. You're welcome. Ms. Ortiz, did you have a question?
Yes, I have a couple of questions. Why are you calling it partially self-funded?
Because we want to have the stopgap in there, the stop loss insurance.
Uh-huh.
That's
And
why
so
it's
that's
called
why
partially, yes.
Okay, then, why are we changing from SBC to Brown and Brown if it's going to be a difficult thing to go? I mean, we're trying to go into self-funded, and why are we changing at this point? Because they've been here for 5 years, or? why are
That's
we
one of the
changing
reasons
from-
we looked at the co-op and wanted to go with different vendors different agents of record, or at least interview them. What was the first part of your question? I'm sorry.
And what kind of,
So our
kind of
agreement, our
experience.
agreement with SWBC actually ends, I believe, August 1st.
okay, what kind, and so they have until August the 1st to try and get Brown and Brown the information that they need to research this if we approve Brown and Brown.
Correct. We will,
Okay.
they would then work together to get all of the data that is needed to start, again, going out for bid on different insurance products.
And is Brown and Brown have a lot of experience with self-funding? Self-funded insurance plans? Are they recommended by other school districts?
We asked, that's what we asked of every group. Who do you have that is doing self-funded? And they were the ones that were able to provide us with Hayes. They do have a couple, several others that are self-funded. A lot of districts don't want to go to self-funded because they're scared or they don't know, or I mean, I don't know for what reason, but I know that's one of the reasons we hadn't done it because we really didn't know more about it.
And then my last question, when will we find out what the costs are going to be?
Well, as soon as we have an agent of record, we will give them the information. They will go out for bid and we will bring everything to the board and to the committee.
So we're talking September, October.
We're
as it
hoping
comes into
sooner.
effect?
Right, we're hoping sooner than that. Now, it won't go into effect till January,
Right.
but we're hoping to then have meetings with the committee, like we mentioned earlier, and then obviously bring information to the board as soon as possible. So that's why we wanted to make sure we had this on the agenda today.
Thank you.
Any other questions or comments?
Madam Chair,
Yes, Mr. Mancha.
I just had, we're voting on this item to do this plan or just to get Brown and Brown?
Just for agent of record, and they will explore self-funded options for us.
So self-funded option right now is not what we're voting on.
No,
Today.
we're voting on the agent of record.
Okay. Just to clarify. Thank you.
that was kind of my question. Who's the agent of record? Who's representing Brown and Brown?
We did not ask them to be here. I did ask, and we did not ask any of them to be here tonight.
Okay, that's what I was wondering. I was like, I don't see nobody else here. That was my question.
Madam Chair.
Yes, let me ask one question. I'm gonna keep forgetting. So if we approve Brown and Brown to be the agent of record to explore the possibility of a partially funded healthcare system in Harlandale ISD, if you opt to not to go that route, what happens to the services of Brown and Brown?
They would still be agent of record, and then we would be a fully self-funded plan like we are now.
Okay, okay. And who will serve as a benefits coordinator if we are partially funded?
Ms. Guajardo will remain as
Okay.
benefits coordinator.
So she's going to be the one that's going to be communicating.
Yes.
Okay, okay. I had one more. Give me 1 second. No, I don't. I think it was answered. I'm sorry, Ms. Limon. Go ahead. Anybody else? Mr. Moreno?
I just had one more thing, if I may. Dr. Salinas, just real quick. Ms. Cavazos posed a good question. If we don't go that model, are they still the best you were still bringing them as the best recommendation?
Yes, sir.
Madam Chair.
Yes, Ms. Limon.
Does, oh, I forgot where his name's at. Mr. Andrew Grove. Does he have, yeah, I know. Does he have anything to say about what, or can we not say that? Okay, that's fine. That's fine. That's fine. Thank you so much. Dr. Salinas, appreciate it.
Madam Chair,
Yes, Ms. Carrillo.
I do have one just clarification.
Yes, ma'am.
Just to clarify, the term service will be for 3 years with a 2 one-year options to renew, is correct? Just clarification.
Yes, ma'am.
Thank you.
Thank you. Anybody else? Mr. Moreno, Ms. Limon, nothing?
No, I mean, I guess I think maybe it's a question that some of my colleagues may have, so I apologize if I'm going over time. But when it comes to this here, 3 years, it's not a typical practice. Could you expand on that perhaps, Dr. Salinas, on the rationale behind that? I know it's because we're building the foundation, but is that why?
Sure. And that's exactly why. So as we talked to the 5 different vendors, that was one of the things that we understood from our interviews with them is that if we do go self-funded, we are going to want somebody who continues to have the experience with the school district. So that way we can continue improving on the program. So then after 3 years, that would also give us enough time to evaluate, are they providing the services that we need? And then we have the option then to exercise 1 year at a time after that.
Any other comments or questions? Okay, can we move forward with a motion?
Madam Chair,
Yes, Mr. Moreno.
I'll go ahead and move forward with, I move to approve the request to procure benefits consultants services to include appointed agent of record of Brown and Brown Lone Star Insurance via the Choice Partners Purchasing Cooperative Contract Number 20/301K9-01 with compensation to be from commissioning rates and annual district fee.
Thank you, Mr. Moreno. Ms. Limon,
I'll second that.
thank you. Before I go for the vote, so we can go back every year and determine whether or not that agent of record is, oh my gosh, a good fit for the district? So it's a 3-year contract,
It's a 3-year contract.
regardless.
No, I'm sure that when we get with our attorney, that we'll definitely put in something there that will protect the district as far as negligent on their part.
Sure, we would look at it to see if there's, to protect the district. If there's something they're breaching the contract, we can terminate it. We'll look at that language.
And the reason I ask is because my concern is, 3 years is a long time to have to wait for that contract to end if our staff isn't getting,
Absolutely. Yeah.
what we expected. That it bothers me. It really bothers me because it's a long time to wait for a contract to be over.
Yeah, if they're doing something wrong, we can put language in there, or if they're not performing up to the requirements of the contract. Yeah, we could
Okay.
put something in there to,
Yes, if we can
give the
be
district some-
as clear and as transparent on that.
We'll work with the
within-
administration and
Yes, within
council.
the law allowed, I would greatly appreciate
absolutely.
it.
Yes, ma'am.
Okay, so I will be moving on for the vote unless there's any other questions or comments? Nope. Okay, Mr. Mancha, yay or nay on agenda item 3D?
I think this is a great idea. I love the numbers. It looked great. But I am gonna abstain only because that person is not here representing himself. And just so I could have gotten a pretty good idea of where he stood and, his experience and stuff. Everything that I read on here is just pretty much Brown and Brown, Lone Star, his name. And I just felt that, it's something that in my eyes, he should have been here. He should have been invited.
Okay, Mr. Mancha. Mr. Luna?
I would say nay.
Ms. Limon?
Yay.
Thank you, ma'am. Mr. Moreno?
Yay, ma'am.
Thank you, sir. Ms. Carrillo?
Yay.
Thank you, ma'am. Ms. Ortiz?
Yes.
Thank you, Ms. Ortiz. And myself, yay. So agenda item 3D passes. Agenda item 3E.
Madam Chair, at this time, administration would like to table this item, request the board to table this item to bring it back to the regular board meeting, the 20th.
Madam Chair,
Yes, Mr. Moreno.
I move to table item 3E as requested by Superintendent.
Thank you, Ms. Carrillo. I
Oh,
apologize.
sorry, move to table it to the next regular called board meeting.
Okay,
Excuse me.
no specific date, just regular, the next, so June 20th?
June 20th.
Okay. Could you include that date, Mr. Moreno, on your
Sure.
motion, just so that
Excuse-
we have clear minutes.
Yes, I moved to table the item 3E based on the superintendent's recommendation for the next regular board meeting on June 20th. Okay.
Thank you, Mr. Moreno. Is there a second on Mr. Moreno's motion?
Second.
Thank you, Ms. Carrillo. I will, no, I don't have to take the vote, right? Or I do? Oh, yes, that's right, it's an individual item. I'm sorry. Thank you so much. Okay, Mr. Moreno, yay or nay to table this until the next regular board meeting of 6/20/22?
Yes, ma'am.
Thank you. Mr. Mancha?
Yay.
Thank you, sir. Ms. Carrillo?
Yes.
Thank you, ma'am. Ms. Ortiz?
Yes.
Thank you. Mr. Luna?
Yay.
Ms. Limon?
Yes.
And myself, yes. So agenda item 3E passes because it'll be tabled and put on the regular board meeting agenda for 6/20/22.
Excuse me.
Yes, Ms. Ortiz.
Patty, on item 3D, what was the final vote?
Agenda item 4. Mr. Soto?
Madam Chair, at this time, I'll have Mr. Hernandez come present, listening to the board's concerns and listening to some of our teachers. As we know, the most valuable resource for students' achievement to be successful is our teachers. And so we went back to the drawing board and we have another option for the board to consider. The other option is still there, the 2% across with the 1,300 retention stipend. This one will also impact our general fund to the tune of another 370. It is an increase to our teachers, but only to our teachers. And it is a decrease to some professionals and hourly employees. At this time, I'll have Mr. Hernandez present this option and go through the entire, and we'll be able to answer any questions if you like.
Thank you, Mr. Soto. Mr. Hernandez?
Thank you, Madam Chair, Mr. Soto, members of the board. So this evening, as Mr. Soto said, is that we're providing a revised superintendent recommendation regarding our teachers. And the change is increasing the percentage based on the annual salary, not the midpoint for the teachers, to 3% from 2% that was presented last week. Also keeping the $1,300 retention stipend. The change on their clerical, paraprofessionals, the classified, and the professionals, that would be at 1.5% versus 2% of what was recommended last week. That all three of those classifications would be at the midpoint. The retention stipend would be at 1,300 for clerical and paraprofessionals, 1,300 for the classified, and the 1,100 for the retention stipend. And again, the difference, the reason for the midpoint is because the majority of the employees then would earn more off the midpoint as a percentage versus doing it based on their current annual wage or salary. So what this means is that when you look at the average teacher's salary that we looked at last week, we use the basis of $59,916 at a 3% raise, and that gives the individual $1,797. A total then, when you add in the stipend, to $63,013, thus a 5.2% increase. When we then factor that into the hiring schedule, a teacher with 0 years at $55,500 would now be getting an additional 3% based on that of $1,665, adding the retention stipend for a total of $58,465. That then translates to a 4.3% increase. A teacher then on a hiring schedule of 10 years is earning $59,689. The 3% translates to $1,791, which then gives a total adding in retention stipend of $62,780, an increase of 5.2%. 20 years, 63,730, a 3% increase of 1,912, adding the retention stipend, a total of 66,942 for a 5.0, for a 5% increase. Now, when we factor in these changes, where that puts us in providing the update of this particular slide that was provided last week. At 0 years, we basically remain at the same level as we do with the other other school districts. However, when you look at year 10 on the hiring schedule, we basically, by this change, we've moved from third to the second highest at 10 years. And then when you look at 20 years, we've moved from second up to first as far as the amount that's paid as compared to the other districts.
Mr. Hernandez, Madam Chair, go back to that slide, Mr.
Yes, sir.
Hernandez. Sir, I just saw this. I'm not sure if we updated. Oh, that's right. You're correct. I was including stipend. You're good.
Oh, yes, sir. The next slide then is providing the results of doing 1.5% on the paraprofessionals and clerical. Again, the same format as what we looked at last week, except when you look at the 1.5% of the midpoint, that is the amount that's changed. So when you look at pay grade 1 for the paraprofessionals, the annual average increase was 21,728. At 1.5%, it's now $358. When you add the 1,300, then a total of 23,386 for a total percentage increase of 7.6%. So basically, we do that for every pay grade. So I'll give you a chance to look at that slide. But again, when you look at pay grade 2, the majority of the employees paid on the pay grade 2 are employees that work 187, which are mainly at the campus. Their average annual wage for that pay grade was $23,511. At a 1.5% increase, it's $377. Adding the retention stipend brings a total of $25,188. So then a percentage increase of 7.1. So the percentage increases range from 7.6 to 3.4. The next group then that we looked at and factored in the 1.5% increase is our classified. So the average annual wage for our classified at pay grade 1, 261, which are mainly your custodians and child nutrition workers, the average annual wage is $24,743. At a 1.5% increase, that would be $500, a retention stipend of $1,300, and that would give them a total of $26,543. Or an increase of 7.3% increase. Again, you do that for the remaining pay grades, pay grade 2, 3, all the way through 8, and then for the bus drivers. So the increases will range from 7.3 to 9.7. The next group then is what we call our professional, those paid on the professional scale. So again, we have at a 1.5% increase, at pay grade 1, the average annual wage for that particular pay grade was $54,603. At a 1.5% of the midpoint is $976. Adding in the retention stipend of $1,100 gives you a total of $56,679. The total in the percentage increase then is 3.8. So this doing that for every pay grade, then the percentage increase ranges from 3.8 to 2.5.
Madam Chair.
Yes, Ms. Ortiz.
Just a really quick question.
Yes, ma'am.
Where are the PEMS clerk on this?
PEMS.
Is which one?
Let me get that. So you would go on your paraprofessional
And they're what?
and let me look. At,
They're which pay grade what?
yes.
3, 4, 5. What's a starting for a PEMS clerk?
Let me, you give me a minute, I'll pull that up. Yeah, so at a pay grade 5,
Thank you.
again, they range from 208 days to 210 days, but the range of salaries for 208 is 27,506. The midpoint's 33,546, and the maximum is 39,587. Okay. The next slide then provides a recap of, as we did last week, of what's the effect on our budget. So as we look at our budget, again, the main change is our payroll costs. So it goes up to 111,593. And as Mr. Soto said, if you look at last week's slide, it basically goes up $370,000 to provide for this change of the increase of 3.3% and the 1.5%. What that then means is then the deficit then now is 12.4 million. Our projected fund balance at the end of this year is 30.5. Then our ending fund balance at the end of 22-23 is 18.1. Now, one thing to point out though is to make sure that we're all aware is this 30.5, that includes our 25 million. So when if all this holds true, then at the end of the year of 2023 of this budget year, we'll be below the 25 million at 18.1. So then as we look at and just factor out to the next two years for 23-24, then of course our fund balance then will decrease to 5.7. And then for 24-25, it will be basically in the red. So basically within this year, towards the end of this year and preparing for 23-24, the district will need to be making evaluations as to what it needs to do in order to address the continued deficit. Again, also we're monitoring our ADA, and of course we're affected by ADA. If it increases, then that increases the amount of revenues we get from the state. But again, we're just looking at everything as if it were to stay status quo for the next 2 years. And again, this slide is basically the slide that we presented last week at 2%. The next slide is at 3%. And this is on your handout as well. And again, just to recap, the superintendent's recommendation is 3% for salaries based on the annual salary as requested by, as we spoke to our employees on that area, the $1,300 retention stipend, and then a 1.5% increase for all the other classification of employees.
Madam Chair.
Yes, Ms. Limon.
Mr. Hernandez, when I know that they give us definition on midpoint, and I just forgot to bring it. When you do midpoint on everybody, does everybody, that's a dumb question. Does everybody get a raise? Or is it varies and how much they get on midpoint?
No, so when we looked at pay grade to the PEMS clerk, so we
Okay.
look at that midpoint, and so all the PEMS clerks are going to get that same percentage, that same dollar amount. So we do 1.5% of that midpoint, and so that's given to all the PEMS clerk, that same amount. So the percentage of the increase will vary because, of course, if you have a PEMS clerk that's close to that percentage, well, then if you're earning less than another PEMS clerk, then your percentage is going to get increased because you're getting the same amount, but it's being computed based on what you're currently earning right now to figure out what your increase is going to be.
So everybody's gonna get a little something.
Oh, yes, ma'am. Absolutely.
Just want to make sure everybody gets something. Okay, great. I just want to make sure that I'm looking to make sure we're not missing anybody. We're not missing anybody.
No, ma'am.
This is everybody.
All employees get an increase and then along with the retention stipend.
Okay. All right. Thank you, sir. I appreciate
Yes,
it.
ma'am.
Madam Chair,
Yes,
If I
sir.
can have Mr. Hernandez also explain to Ms. Limona and the Board of Trustees, if we don't go off a midpoint with those hourlies, on how the top individual is going to keep expanding, going higher than the one that's lower, and if they go off of salary.
Sure, sir. And that's exactly right, just as you said. So again, those that are earning more, and as we know, the math, that's going to be a higher amount that they're going to be earning as far as an increase. And of course, if your salary is lower than that point, then your increase is not going to be as much. But then that starts affecting the employees that we're keeping within that pay range. You'll start earning employees, you'll start having employees get closer to the maximum then, and not trying to keep it equitable with everybody within that pay range. So we're looking for equity in there.
Any questions, comments?
Madam Chair,
Yes, Ms. Carrillo.
I do have a question, sir. You know, in regarding to the budget summary, I see here that for 22, 23, there will be raises, but once you go into 23, 24, 24, 25, there will be no more raises, but we're still gonna end up in the red.
Yes, ma'am. Benny, can you allow me to get back in?
So without having any raises, why are we still gonna end up on in the red if we're not in the red?
And that's a great question, because what happens is that, and we have this with every budget year, is that when we look at our payroll costs and we provide for the raises, well, that's a recurring cost. So that amount is going to continue. So if we are already projecting to end the year in 2023 in the red, then basically we're saying that same amount is going to be occurring. The only way that this would not be in the red is that we earn more revenues, or we make adjustments on our payroll cost, either through allocations, program changes, whatever we can do as we reevaluate each year our programs to see, okay, do we need to fill a vacancy? Are we meeting the need with something else? So, you know, that your biggest impact is going to be in payroll, because that represents 82% of your budget. So basically what we've always said is that on the payroll cost, it's a recurring cost. The only reason that wouldn't go down is because if we stay it as it is, the only way to reduce it is to take back the raise, and which is not what we want to do. And so that's why basically when you end up at 18.1 million, because you had a deficit, a negative, then that's basically what's left over in the savings. So now that savings rolls over here, and we're going to be getting the same amount, and we're going to continue with the current cost that we've got right now, which is a recurring cost, then we would be at a deficit of 12.4, which then would reduce our ending fund balance at 5.7. So again, if all that stays consistent to the following year, then that's where we would be looking at a negative. But, you know, the district would need to take steps as it's planning 23, 24, how to try to avoid this particular area.
And well, excuse me, and will it not still continue to affect if our ADA continues to go lower?
Oh, absolutely. Because as you said, if our ADA does go down, then this amount will go down
Thank you,
because
sir.
it's driven by ADA. Yes, ma'am.
Ms. Cavazza.
Yes, Dr.
Question,
Casablanca.
please. Mr. Hernandez, we talked last time briefly about the state's expectation for your fund balance, and you said 2.5 months operating expenses. How does that translate to money?
So in money, it's 25 billion, which has been the objective of the board to try to
is
preserve
that
25
result.
million.
Okay, so beginning 23, 24,
Yes, ma'am.
you
So,
don't meet the state's expectation.
yes, ma'am. Correct.
Madam Chair,
Yes, Mr. Moreno.
if I may, I don't know, Mr. Ortiz, were you next? I'm sorry. So going on, because I remember those are all hypotheticals. Can you also elaborate how many times we've actually been under 25 million in the last 8 years?
Sure. Well, I mean, what I can do is show you a fund balance.
Well,
trend.
I can answer it because I think we've been above 25
Well,
million
sure. And
every
so,
year since the last 7-8 years that I've been a part of this board.
so 2013 to 2014, that's
In
correct.
terms of a fund balance,
Yeah. So right now our fund balance is at 30.
that we've been able to maintain our budget for this year. I'm not saying saying one or the other, but I understand that we have to follow the what you provide for us, and we've been able to do so for the most part but unfortunately, we've had deficits here and there. But that's just something I wanted to note. The other thing is the payroll costs that can be adjusted because right now we're doing attrition, right? The likelihood of us keeping that payroll cost is going to change, isn't it?
Well, this is already factoring in the attrition that we looked
No,
at in
that'll
our
be for this year,
allocation.
but for 23, 24, because you always
For
give us
23,
you always
24.
give us the most conservative projections.
Yes, well, so as I said earlier, that when we start preparing for the 23, 24, and as we go to 22, 23, we're always evaluating our programs. So yes, if there's vacancies that exist that we're not needing, then that would be the most prudent thing to do, is not fill them, because we know we're facing 23, 24 with this kind of circumstance.
Yeah, and unfortunately, we have lost teachers at a pretty high rate, and Dr. Salinas can attest to that just as well. And that's something, unfortunately, that all school districts are going to face the next couple of years. And so if enrollment's going down, and obviously has to reflect, that's one of the questions that I did ask Mr. Soto, and I'm sure you guys will get it to me and to the board later when it comes to like, how would it impact the learning experience? But really, the question is, it's tough. Obviously, if you're presenting this plan, to me, the other plan is better. I don't want to, in my own personal opinion, like to say teachers are more important than clerical staff, or more important than our, professional staff. It's just tough because when you look at the numbers, I mean, it's a difference. And then when you're going off of, it's kind of like forcing our hand, saying the better plan is the original presentation. I appreciate you guys crunching the numbers, trying to do something based off what our teachers said. But it is tough to kind of say, hey, we're going to give teachers a little more. I know SAISD kind of did that right with the 3-2-1. And I think maybe even Judson did that when they presented their plan as well. But it's kind of tough to kind of support if we're going to choose one group versus the other. But I was also wondering too, when it comes to our professional staff, why the 1,100 versus the 1,300?
With the ESSER funds, again, we put it to more the individuals with teachers and the hourly. We thought the professionals can take a little bit of less. But to piggyback off the general fund, what we need to understand is we've had a healthy fund balance for a while here at Harlandale. And I'm not pointing fingers, but there was positions created and it's a residual. So if you create, let's just be conservative and say 40 positions were created 10 years ago at 40 times 50,000, and then it's residual and it hits the general fund and hits the general fund. As you noted, Mr. Moreno, yeah, Mr. Hernandez will give us a conservative side and say, we're going to come out 10 million in deficit, and ends up being, we come out even. And he has a chart. If you can have that chart presented, and we're going to share with the board because we shared it last time, is what it's looked like the last few years. I think one of the trustees asked us this question on the last few years, what has been projected and what it has actually been. Well, this last year, he was pretty spot on with what it was projected and how much the deficit was. And it keeps eating away at our general fund because our general fund is not creating any more revenue because our ADA keeps going down. And then with COVID, you multiply it towards COVID, and then our ADA, and then our older homes. We just don't have enough children being born here at Harlandale. There's a multiplication going on here at Harlandale. And what we're trying to do is we're trying to be aggressive, but we're also, in reality, we shouldn't have any raise. In reality, there should be no raise across the board. But we know that the other school districts are enticing, they're going to entice our staff to leave us, and our staff is valuable to us. So we're trying to be creative as possible to give these staff members that raise that other districts are doing. But those other districts, some majority of them didn't give raises when Harlandale kept giving raises the last 5 years. And we stated that the previous week. As you look at the comparisons where we're at right now, we're still on the top of teacher salary, top 2, top 3 of salaries here in San Antonio, with a lower property wealth. But this is the fund balance summary, and it's really and I hear where the board is going, but this is reality. Our general fund, these numbers are as Mr. Hernandez said, they're not going to change unless we have a spike in ADA, which is not 200, 300. We're gonna need a couple thousand kids to come into Harlandale. Or we're gonna have to evaluate programs and staffing. And that's the reality. So I'm gonna turn this over to Mr. Hernandez to explain this fund balance sheet. Thank you.
Thank you, Mr. Soto. So what I put up on here is basically taking our fund balance and you can see these fund balance totals on our financial statements. So back in 13-14, our fund balance was at 55.3. But then as you look at the next years that follow, it drops down to what we're looking at what we looked at the end of the year of 2021, which was this past year at 35.2. So the total amount of the fund balance that's decreased from 13-14 down to 2021 has been a decrease of 21.4. So the district has been utilizing its fund balance in order to stay attractive to teachers, to try to reward its employees. But now it's getting to the point to where, especially after when we took the big hit in 2021, again, going back to that hold harm list where we thought the state was going to be funding that, but yet now they have us taking it out of our ESSER. So that's what produced a big drop of about 9.5 million. So again, this does give you the fund balance trend. As you said, Mr. Moreno, we are above the 25 million, but we see this trend and it continues. And again, it's due to the ADA as it decreases. And so that's where we're affected now. You know, granted, the end of COVID started in March of 2020. We had a full year of non-student, non-attendance for virtual learning. And now we're in 21-22. And we're projecting our ADA to be about 10,179. And when we looked at our ADA in last year of 2021, they were actually computing at about 9,700. So we're doing better. But I think that's the effort that we're trying to make to bring in students, but also be cognizant that our fund balance is going down, albeit it is above the 25. But again, when you look at the recurring costs in the other slide that we're presenting, it's going to get us to the point where we're below the fund balance.
All right, thank you, sir. And if I may, ma'am, if I can continue, I had a couple more things I wanted to address.
Yes, but give me 1 second. Mr. Hernandez, I don't think we have a copy of that.
No, ma'am.
Oh,
No, ma'am.
could you all
Sure,
provide a
absolutely.
copy
We'll
to us
provide you a
before we
copy of
leave?
it. Yes.
Okay, thank you so much. Go ahead, Mr. Moreno.
So I don't know. I mean, I know sometimes when you say things that kind of misinterpreted, I mean, by no way am I conveying like do this, do that. I don't think that's come out of my, with the dialogue that I'm sharing. But I definitely understand, the candidates that our superintendent, Mr. Soto, you're speaking with, when it comes to information, like I asked you earlier. I mean, I know it was a little late, but I appreciate when you get the information to us. It helps to get a better understanding and more context to it. But here and again, to this too, it's like what I'm saying is we're still working within it, and we're still by no means are we going to be like if there is dire straits, we're going to do what's required to make sure that we follow through and keeping our balance, where it needs to be. So I think that's where some people misinterpreted and misconstrued what was being conveyed. But at the same time, to me, it's just it's really important just to see it's a couple of things and just noticing the differences in how we're utilizing those programs and how we're utilizing our GPIs. I mean, that's just something that was presented. But I know you guys are putting together a plan. I appreciate in the midst of not having the ability to do so, but still going forward and presenting something. To me, it's better than not offering anything at all, as Mr. Soto has done in the past. So, appreciate that.
Anybody else? Ms. Ortiz?
Yes, thank you, Madam Chair. If I'm looking at this correctly, last week's presentation is actually more expensive at 2% across the board than what you're presenting today. Is that correct?
Yes, ma'am, by about 370,000 per year.
Okay. And then since all of our monies are based, they're ADA, I'd like to know at some point in the future what the district as a whole what the plan is to raise our ADA. And the only reason I bring this up is because my niece works for IDEA, and they get paid for every child that passes STARS. And they get paid a bonus for every child they bring from a public school or into the system. And so I'm just throwing that out there because I got so frustrated with what she was telling me that's happening at a charter school. I'm just throwing it out there.
Yeah, I understand, man.
But man, when I look at what we're facing, it's scary. It is scary. And it's going to be hard to explain to our parents why in 2 years we're going to be broke. So those are my comments. Thank you.
Thank you, Ms. Ortiz. Anybody else? I actually do. And I don't have a question. I just have a comment in general. You know, determining what is best for the students, unfortunately, sometimes boils down to very hard decisions. You know, do you give more and do you give more to some and take away from others? Do you keep everybody here because everybody works because they have to make a living? Do we want to sacrifice programs for our students? You know, to me, that's going backwards and not forward. So whatever the outcome is of this board, I think it is important for me to voice that any business decision that we do makes an impact. Sometimes it's a good impact and sometimes it's not such a good impact. And there will be people who will be happy with the decision and there will be those that aren't. I don't think it's a win-win at any point in any scenario. I do appreciate the options. Walking in and saying this is the only thing we have to offer is very difficult to swallow. And so I appreciate the work of going back to the drawing board and you know, figuring it out. I also know that this comes with great responsibility, these decisions that each of us have to make individually. And I just want to let the community know we can't do this alone. Bringing more students into our district, enrolling more students into our district, bringing them to take advantage of the great opportunities that we have here, that takes a community, that takes the community to help us also engage other families to have what we have here at Harlandale. So I hope the community is listening and is wanting us to continue to move forward, and they can hopefully help us get the word out of all the opportunities and possibilities there are for each child that is enrolled here. But I do want to thank the staff for going back and doing the work, because I know it's a lot of work. So I appreciate that. Those are just my comments. Anybody else? Yes, Mr. Luna.
I said on comments, you know, y'all know most semester I've been here this district a long time. I taught in this district. And we went to the graduations and I saw a lot of my ex-students graduate. You know, I had them pre-K, kinder, third grade. And what Ms. Ortiz talks about, the idea, I have family members also go and come back and forth. And they've gone IDEA, KIP, and I don't know why they jump around so much, but they seem to, I don't know why. They're looking for the gold ticket or something. I don't know what their idea is, but that makes me think my marketing, I have a marketing degree. We have to market ourselves and present ourselves something to be attracted to. And that's what's gonna bring our ADA. Because we know we're landlocked. We know we don't have these families coming in, like maybe other groups. So that's what I'm thinking we can base ourselves on. When I went to San Antonio ISD, when the charter schools were taken over there, I looked at the back of the board meeting and all they had, most of them, the pictures were of sports. They have all these sports they offer, sports. And I'm thinking that is the tradition. That is traditions public schools are built on. I mean, I looked at the sports and they're always saying, we're great. When McCollum came out and now they're Reagan, they always put the big schools because they want big numbers. And then it's up with the little schools also. But I'm trying to say is that we need to promote ourselves some way, somehow, and get these people back to our schools, back to where their parents went to. I hear a lot of parents say, I'm not going to put my parents in your school district because the parents over there, blah, 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 blah. And the teacher did this and this. But if we offer the programs that those people that are attracted to going to other places, and we do a better job at doing that, I think we will increase our ADA and won't have to worry about this budget this budget deficit. And that's where I feel that I think we need to work on. You know, a lot of people say, don't worry about the things you can't control, worry about the things you can control. And that's what we can control is how we present ourselves. And that's where I think we need to focus on. Because we had a lot of great things going on. They mentioned at the graduation, all these kids went to state, they went to playoffs and they did this and that. We have one of our McCollum graduates, he's going to represent Texas at the Special Olympics in Florida this week. Did y'all know that? Did we promote it? That is our legacy. That is who we are. That is what we produce. And I'm glad to say his mom works in my school, ex-school, and they did a fundraiser and he's able to go in and join himself and represent our state. And where did he say? He's representing McCollum. So that's what I'm saying we need to do is somehow come up with a marketing campaign. And I've been just a long time, Miss Mariana, what's your last name? I know she. Mariana Bravo, Bravo, right? That it's a lot better than when I started 30 years ago. Well, we still need to, I hope I didn't harp on this, but I mean, maybe I watch too much TV, but there is a way to get the word out. And I do see the postings on Facebook and I think we could do more. I could do more to get the word out about how we're doing so well in our district. I think my 3 minutes are up. Thank you.
Madam Chair.
Yes, Ms. Yvonne.
So we go back and forth with all these numbers and we, I'm just thinking out loud. When we passed $125 million bond to create these new classes for our students. Hopefully pray to God that we get more students to come and enjoy our extra CT classes, to be certified as a dental hygienist or a mechanic, or I mean, are we looking at that also and creating more students coming in? Or do we have an idea? Are we getting? I mean, I'm sure I'm trying to figure that out also, and I don't have a number. I mean, are we looking at that too? Are we, once those buildings are built, once those classes are created, once we get our, certified teacher in there, are we thinking about how many students are we going to be having in there? I mean, I just, just puzzles me that, we're doing all this and hopefully we get to fill them up with our students and ADA comes, hopefully seeing all that, seeing the Memorial Stadium, and we're getting more students to come in. I mean, I'm hoping and praying that bring them in, because they know that we're creating these classes, because we passed a big bond. Is this gonna look any different? Hopefully it's gonna look different. I'm just thinking out loud because it's like, all these numbers, if that happens and we get those buildings up, hopefully these numbers will be different. That's what I'm praying for.
Sure, and that's exactly what the main purpose of the bond issue is. And that's one of the things that the board took a big step on doing the maintenance tax notes, to start doing these improvements early instead of waiting till we pass the bond issue. So now we're going to have auditoriums ready. We're going to have a part of the stadium ready, so that everybody that goes down Roosevelt sees the changes, the construction that's going on. The kids at the high school see the auditoriums being improved. So they themselves help to get the word out, to let others, their friends and other students that they know, to enroll and tell them, witness, what's being done at our school. So, I mean, steps are being taken in order to make the district more attractive, because as Mr. Luna just said, it's marketing. So if we continue doing the same thing, how is ADA going to increase? We've got to do more, and we are doing more. So, and the community supports that because they passed the bond issue. And so we believe that's going to increase the ADA. But again, we don't want to make a projection of how much that's going to increase, and then for some reason it doesn't. And now we're stuck, and it's too late for us to turn the boat and try to address the deficit.
Madam Chair,
Yes, Ms. Carrillo.
I do have, the question in regards to the projection. You're saying we are going based on the projection that it is going to increase. Okay, and if it doesn't increase, my next question, and gosh, they're probably gonna throw tomatoes at me. Do we have to do this at this moment?
You mean this evening?
No. I'm sorry. I'm saying this in general. Do we have to go forward with this? I mean, what is your recommendation, Mr. Soto, in regards to these? If
This
you
is
don't
just a
mind my
workshop.
asking.
Oh, yes, ma'am. This is just a workshop. We're actually going to take action June 20th.
Still, I am asking, what is your recommendation? Because all we see is red.
There's two recommendations. The one from last week, the 2% across the board, and then this one that's 3%, and then 1.5%. 3% would be for the teachers, and then the 1.5% for everyone else.
Okay. I'm sorry. I guess I'm not making myself clear. Can we wait on the raises?
No, I believe, again, that's a legal question. I think there's a lot of red tape that we would have to do if we have to wait. If you're saying to wait, yes, good question, man.
Well, you wouldn't want to wait too long. I mean, you have to give teachers the opportunity to know what they're gonna be making. So there's a deadline for them to resign 45 days before the first day of instruction. So you want them to know what they're gonna be making. And then you have the deadline with regard to passing your budget and all that other good stuff. So you don't have a lot of time. No.
Madam Chair. And
Yes, Ms. Lima.
and just to, and you're right, but we need to make sure we make a decision right away, because we don't want to lose our teachers and say, well, we're going to still get paid and they're not giving us anything. So we want to make sure we give them something so we could retain our teachers. We don't want them to leave us. So I think we need to make a decision quick. Hopefully we can make the right decision. So that's my point.
Madam Chair,
Yes, Mr. Mancha.
today I had the privilege of going to one of the schools for the 5th grade promotion. And I ran into the salutatorium from Harlandale. And she was all excited. Her brother had gotten AB honor roll. And I was thinking to myself, wow, look at all these little kids. Not only them, but there was a lot of little kids. And I'm like, where's our staff that we could have been promoting and pushing to sign up some of these kids for pre-K? There were a lot of 3-year-olds, a lot of 4-year-olds, a lot of 5-year-olds. And I'm like, wouldn't this have been a great opportunity to have some of our staff promoting, instead of just having the 5th grade teachers, the only ones there, but we could have sent somebody. That's just an idea, sir. How, when Mr. Luna was talking about promoting ourselves, and that would have been a great opportunity for us to promote ourselves. At these events, when their older brothers and older sisters are getting recognized. Can you imagine? I was looking at the little kids and they were clapping for their little brothers, and they were all excited for their big brothers and sisters. And that was the first thing that popped into my head. Why aren't we doing what IDEA does? Come in here and sign them up and get them enrolled. You know, you brought a lot of good points, Mr. Luna. You know, the other thing, I got a phone call earlier today, and I told her I couldn't talk to her, and she goes, "It's okay, Mr. Mancha, you can talk to me because I'm leaving. So it doesn't matter." And I said, "Okay, ma'am." She goes, "I'm an art teacher, and Hardendale doesn't promote art. All you hear is about football, baseball, basketball." I said, "I've been an art teacher for 13 years in this district. The only way that it gets promoted is at main office, but my parents can't go over there and see it. You don't see them on displays. You know, we finally did something and you can see it on the VIA bus. You know, and at first, like I said, I told her, I can't talk to you, ma'am. You know, you got to call main office if you have a complaint." And she goes, no, it's all right. Because I got a better opportunity somewhere else where it's promoted. And those are the things that we need to concentrate on and we need to focus on. You know, to lose great people like this, I've known her first year she started, she brought a lot of grants. She would apply for the grants herself just to push those kids. You know, and it's so sad for me to see her leave after knowing her for all those years. But those are just ideas, sir. You know, things that, you know, when the only way we're going to get our DEA, I agree with Mr. Luna, is we got to promote Hardendale. We got to do the exact same thing like Ms. Ortiz said, promote ourselves. You know, I always like to say, I like to steal ideas from somebody else, and we can steal an idea from IDEA. So that's an opportunity, sir. Thank you.
Thank you, Mr. Mancha. Anybody else? Yes, go ahead, Ms. Ortiz. Yes. I wasn't sure if you were staring at me or you wanted to ask a question.
I'm not saying that what that other school does, that charter school does is the best. I'm just saying that not to reinvent the wheel, explore those kind of options. I know everybody is talking about sports, but if y'all know me, I spend a lot of time at the baseball field. And what am I promoting over there? Middle school baseball. And you know how many parents tell me, I'm going to switch my child over to Harlandale so we can play middle school baseball. And you know what I tell them? That's great. But you know that they have to make the grades, right? And they were like, oh, okay. No, I didn't know that. And I said, but this is good. This is good that we're getting that kind of feedback. I had some of the kids from Five Diamonds that already this year transferred because of middle school baseball. And I know y'all don't like to hear that, but that's the reality of where I am at, what I'm doing. And now what am I doing? We have 3 and 4-year-olds registering to play T-ball. And guess what? I have a stack of flyers that Mariana printed that we offer pre-K 3 and pre-K 4. And guess who's getting those flyers? The people who register to play baseball at Five Diamonds, because they're 3 and 4-year-olds. They can't wait. They can't wait. They're like 2.5. Miss Ortiz, can you make an exception and let them play? Where do you live?
It takes a village. It does take a village. Yes, Mr. Luna.
Just what we used to think in the union, the teacher union, they're coming after your job, those charter schools. And they are coming after your job. And the audacity of the governor to come into this district to promote charter schools should light a flame under our you-know-whats to do something. After the shooting, what were they telling President Biden? Do something, President, do something. Don't just come and go, but do something. So we need to do something together, individually. And I don't want to just if dogging sports is bad. After being here a year, I didn't used to be for I know Miss Cavazos tells me things, but I was just education. I wear my rings. I wear my dad's ring. But I also realized I need a plumber, I need an electrician, I need a mechanic. My truck's broken right now. So we need to promote whatever the kid, the child needs to go to provide for themselves a better future. The military, I want to stand up to those for those kiddos. Because I appreciate my dad went at 18 years old into the Marines. 18. I just can't imagine going to war. He went to the Korean War. After 2 years of training, he went to the war. And he came back, thank God I'm here. But we need to applaud all those kids, all those different. After being a teacher, you know, there's all kinds of kids. There's all kinds of kids. They do all kinds of things. But when that light bulb goes off, when you see that drive in their face and you see that smile, it's worth it. It's worth it because you affected their lives and they're going to help you do better for themselves and their families. And that's why we're here for the kids. Here, kids first. It's kids first. I even wear a button now, kids first. But it takes us, the village, to get them there, Thank you.
Mr. Luna, you didn't clarify if the things I tell you are good or bad, though. We'll just leave it at that. We'll leave it at that. Any other comments or questions? Anything else, Mr. Hernandez?
No, ma'am.
Thank you. Yes, thank you very much. Before we move on to agenda item number 5, does anybody have anything they want to share? Mr. Mancha?
Madam Chair,
Yes.
I do. I want to thank staff. Dr. Salinas, great job. Thank you on the presentation. I really enjoyed it. I learned a lot about self-funding. Mr. Hernandez, good job, sir. I know you got to put up with us, but thank you very much for putting up with us. Dr. Hinojosa, thank you. Ms. Casey, I know you had her back, ready to go. And Mija, you're doing a great job. Okay, so I just want to say thank you. You know, sometimes you guys don't get the respect from a lot of people because, you know, you guys are the bad guys. And then we're the worst guys because we're the ones that have to vote on it. So, but thank you. I know it takes a lot of work and dedication. And of course, you, Mr. Soto, thank you, sir. You know, you got to put up with all of them, not only them, but us also. So thank you, sir.
Madam Chair,
Yes, Ms. Carrillo.
I move to adjourn.
Give me 1 second. Is there anybody else that wanted to share something before we do a second?
Madam Chair.
Yes, Ms. Cordy.
Because unfortunately, I had to miss many, many friendly faces, families at the Harlandale High School graduation and the McCullum High School graduation. I got to tell you, it broke my heart. It was very difficult to write that text and send it to you and Mr. Soto. But I wanted to take this opportunity to tell him congratulations. It's the happiest day of a senior's life is to walk across that stage. And congratulations to all of those that were able to do that. Thank you.
Madam
Thank-
Chair,
Yes, Mr. Moreno.
I just want to say thank you to Mr. Soto and staff, all the wonderful things this past week. But also to Mr. Soto and staff for putting the best foot forward and doing what's right for our community at this time with deciding to end school tomorrow. So thank you, sir, for doing that and being the instructional leader that you are. Can second if no one else is gonna,
Okay, you're gonna second it?
if no one else is gonna say anything.
Okay, and I just wanted to say before I move on with a vote that we're still hopeful for change, and not only in ourselves, in our community and in our state. And we're still in constant prayer for our neighboring district and their families. So moving on with the vote to adjourn the meeting. Ms. Ortiz, yea or nay?
Yay.
Mr. Moreno, yea or nay?
Yay, ma'am.
Mr. Luna, yea or nay?
Yay.
Mr. Mancha, yea or nay? Ms. Ortiz, I'm sorry, Ms. Limon, yea or nay?
Yay.
Ms. Carrillo, yea or nay?
Yay.
Myself, yay, it is. Hang on a second. 8:20. We are adjourned. Everybody be